Are you feeling thirsty? Are you always running to the bathroom? You might have undiagnosed diabetes. This video will examine 10 signs and symptoms of type 2 diabetes. Coming up. I'm Dr. John, board certified in internal medicine as well as geriatric medicine. This channel is here to promote your health and your well-being. Think your health. Type 2 diabetes is a chronic medical condition where your levels of glucose or sugar are increased in your blood. Insulin is a hormone produced by your pancreas, and it moves sugar, glucose, from your blood into your cells, where it can be used as energy. You can think of insulin as a key helping glucose into these various cells. Now, what happens in type 2 diabetes is your body fat cells, liver cells, and muscle cells do not respond well to insulin. This is called insulin resistance. Your pancreas ends up producing more insulin to try to push sugar into your cells. But it reaches a point when it can't keep up and there is too much sugar in your bloodstream. In type 1 diabetes, your pancreas cannot make insulin or makes too little insulin. In type 2 diabetes, the body's cells do not respond to insulin or your body cannot make enough insulin. What are the 10 most common symptoms of type 2 diabetes? Polydipsia is another way of saying that you're extremely thirsty. Elevated blood glucose levels make your kidneys produce more urine to get rid of the extra sugar. In other words, you're peeing the extra sugar together with water out of your body. Now that you're losing so much fluid, you're at the risk of getting dehydrated. Your brain gets signals to drink more water. If you're unable to drink enough water, dehydration can lead to increased levels of sugar, which is also referred to as hyperglycemia. Symptoms of prolonged dehydration are nausea, faints, headaches, and dizziness. Polyuria means you are peeing excessive amounts of diluted urine. Polyuria is one of the classic symptoms of diabetes. Like I explained earlier on in this video, your kidney plays a role in filtering and reabsorbing urine. Polyuria in diabetes occurs when you have excess levels of sugar in the blood. Normally, when your kidneys create urine, they reabsorb all the sugar and direct it back to the bloodstream. With diabetes, excess glucose ends up in the urine where it pulls more water and results in more urine being peed out. Normally your kidneys would be reabsorbing as much glucose as possible. However, in diabetes, your kidneys are unable to reabsorb the sugar and the excessive sugar is peed out together with fluid. This means that you're getting up at nighttime to pee. There are other diseases or disease entities such as congestive heart failure as well as prostate disease, which can also present with similar symptoms. Once again, because of excessive sugar levels, your kidneys have to work harder to get rid of it. Elevated blood glucose levels can make your eye lens swell. This is because of the flow of glucose in and out of your eye. Naturally, if your lens swells up, your vision will be affected. It is important, if this is occurring with you, that you follow up with your eye doctor to help with the diagnosis. Persistent elevated blood sugar levels can lead to damage of small blood vessels in the back of your eye called the retina. Your retina is important for communicating visual signals to your brain as it consists of light-sensitive tissue. The damage to the retina secondary to diabetes is called diabetic retinopathy, and a complication of this type of retinopathy is decreased vision and, in the worst case scenario, blindness. Weight loss is also a symptom of diabetes. This is because glucose is a source of energy. Now, if you are a diabetic, you're not producing enough insulin. Insulin is important to get sugar into your body cells to be used as energy. Diabetics lack insulin, therefore if there's a lack of sugar being pushed into the body cells as an energy source, the body has to look for energy elsewhere. Your body starts burning body fat as well as muscle as an energy source, and because of that, you lose weight. This means you're eating excessive amounts of food. If your sugars are excessively high, as you see with uncontrolled diabetes, glucose is not able to enter your body cells because of the lack of insulin or because of insulin resistance. So your body is not able to convert the food which you are consuming into energy. As energy is lacking, you feel this as hunger. Diabetes can lead to a variety of serious complications, and in this video, I'll look at the most common complications of diabetes. As a diabetic, you'll be feeling tired and weak because of the lack of energy. You have a general feeling of weakness, and this is as a result of your cells not getting enough blood glucose. As a diabetic, you're more prone to get infections. The reason is persistently elevated blood sugar levels makes your immune system weaker, coupled with reduced blood flow in your blood vessels. The most common infections associated with individuals with diabetes are urinary tract infections and vaginal infections, skin and soft tissue infections, as well as ear and nose infections. Diabetes, because of chronically high blood glucose levels, can lead to nerve damage. About 60 to 70% of diabetics, because of progression of disease, will develop a neuropathy of their extremities, usually in their lower extremities and sometimes in their upper extremities. This is because of the damage to the nerves, and these damaged nerves cannot effectively communicate and send signals to the brain and to other parts of your body. You'll be having symptoms of pins and needles and sometimes complain about a burning sensation in your hands and feet. Neuropathy can be advanced with some individuals, and you might not be able to feel pain or even sensations such as heat or cold. You must be very careful in terms of skin care, as you're more likely to get infections secondary to poor blood flow, and also you'll be faced with poor wound healing and have an increased risk of developing foot ulcers. The skin is the largest organ of your body. As a diabetic, not only are you more prone to infections, but you're also prone to dry, itchy skin as a result of poor blood circulation. As explained earlier in this video, excess sugar is pulled from your cells, making your skin drier. There are several skin conditions which are related with diabetes, which I'm listing right here. If you're interested in a specific video looking at diabetes and diabetes-related or associated skin conditions, leave your comments in the section below. Here are more videos, and you can click right here or click right here. Have a good day and think your health. It's like so dumb that I cannot see if this is straight or not. When it looks straight, it appears to be straight. It's straight. Oh, now it looks a little bit better. I think everything went pretty well. Oh, audio source. Forgot to, there was no battery in there.